everyone. My name is Kate Warnock. I'm GuideWell's social media manager. We're coming to you live from day 2 of MediFuture. I'm delighted to have today with us in the GuideWell Insights Lounge the CEO and Chair of Welltok, Mr. Jeff Margolis. Jeff, welcome.
Thanks, Kate. Good to be here.
We're happy to have you. So we know that you have a wonderful living ecosystem here at MediFuture. Can you tell us a bit more about the Welltok exhibit and how it's been received here?
Oh, well, it's been very exciting to be here at MediFuture. You get to see a whole bunch of thought leaders putting out a whole bunch of different innovative ideas. I think one of the great things about the Welltok exhibit is that everything we're showing today is something that we're actually doing today, which comes with a number of years of hard work and a lot of investment. But what we're doing is we're introducing the audience here to the concept of health optimization, which is not wellness and it's not sick care, but it's the idea that what we're trying to do is, whether for an individual person or for an entire population, we're trying to create the highest health status at the lowest possible cost. And that's the definition of healthcare value. Now, most of the time, people think about lowering healthcare costs in terms of how much does it cost to go to the doctor? How much does it cost to get a prescription? How much, what's the cost of a test at the hospital? And those are all things that we do need to solve through better patient-centered care and smart care teams that we've talked about here. But most of us, most of the time, about 85% of the population at any point in time is not in patient state, we're in consumer state, okay? And what's being done for us to help us stay our healthiest and get access to the activities that we can be involved with that are available to the consumer without having to go into a clinical setting at all.
Right.
And I've spent so many years in the industry, really the better part of 20 years driving administrative efficiencies into the connection of getting people access to sick care, that it made sense to get into the business of helping people optimize their health.
Right. Well, that's an interesting, very logical concept, you know, and I know that so much of the focus here at MediFuture has been on consumerism. Jeff, what does Welltok do to help motivate that consumer to embrace preventive health? If perhaps, you know, it's perhaps easy to talk to someone who already is taking pretty decent care of themselves to take it up to the next level. How do you start with someone who's not really paying attention to their health quite as much as they need to be? Yeah,
it's a great question, Kate. There's a big difference. Here's what I like to say is first let's establish what a consumer is, right? So patients receive care. Consumers make choices. And so we talk a lot about engagement. Well, an engaged patient is compliant or adherent with a treatment plan handed to them, usually by a professional who's a lot smarter than I am clinically, right? But a consumer makes conscious choices in healthcare. An engaged consumer would be thinking about, what is my health status? What is the cost of that, and how can I be proactive in achieving it?
Right.
So what we do at Welltok is we help align consumer actions and behaviors with incentives and rewards in the context of their benefit plan, their location, their preferences, their health status, their family status, their economic status.
It's completely customized.
Yes, and we use the word personalized, right?
Okay.
And the biggest problem that we have sort of bringing some of these Silicon Valley business to consumer constructs into the healthcare industry is we've been able to show great success with platforms like Google and Facebook and so forth, that one size fits all in terms of a user experience, right? That's not going to work in healthcare. It's never going to work in healthcare. And so what we've done with the Cafe Well Health Optimization platform is we've we've taken lessons from all those great companies, and we've taken lessons from all of our years of experience knowing how the healthcare system works, and we've created a platform that gives you what's called a personal health itinerary that shifts and changes with you, frankly, in the moment.
Wow.
And no one's ever done that before.
Right, right. So obviously, the right technology powers your solution for consumers. I'm wondering, what role does IBM's Watson play in that healthcare concierge component of the Welltok ecosystem?
Yeah. So GuideWell Concierge, which is a wraparound offering from GuideWell, is powered by Watson's cognitive computing capabilities. So to answer that question, let me just explain a little bit about cognitive computing. There really haven't been too many advances in health information technology in the last 30 years. If you go back about a decade and a half, of course, we got search, right? And that was pretty profound as Google broke us through on that. But the notion of moving from a world where computers process logic based off of algorithms that are usually driven off of structured data.
Right.
And the whole healthcare world has been built around structured data that's specifically geared towards reimbursing physicians and hospitals and pharmacies. That's not a bad thing, but that's certainly not the way consumers take information, right? They don't think of themselves as diagnostic codes or procedural
Hardly,
codes.
right.
Well, what cognitive computing does is it learns like we learn as humans. It reads, it is given choices, and if it makes a wrong choice, it's told that that's a wrong choice so that it can make a better choice the next time.
So it's getting smarter.
Getting smarter.
Right.
And the way that you work with IBM Watson capability is you teach it or train it in the types of questions and content that it needs to answer. And that intelligence comes from us humans who know the industry. But what Watson can do, Watson can ingest more pages of text or information than any human could ever hope to in a lifetime in just a few seconds. And so what we're doing is we're building corpuses that are individualized to a consumer. But I should point out that in GuideWell, a consumer is anonymous. Your identity is protected. And then we also point Watson at other sources of information that we know about you from your health plan, from your provider organization, even from your retail pharmacy, so that the experience becomes more and more personalized to you. It's literally like having a healthcare concierge in your pocket.
So truly, it sounds to me what this has done, it's not just an aggregation of data. You have assimilated it, you have put it in a framework that now the right decisions can be made specific to who you are based on your health experience. That's phenomenal. That seems like a breakthrough.
Well, and it can lead you to action.
Right.
You know, I've been in this industry a long time, and everybody talks about, now everyone's talking about big data, and everyone's talking about predictive analytics. And I always say, okay, so we crunch all the data, we do all the analytics, we get the list of people that we want to do something, so what? Right. So what? Who's going to get them to take the action? Right. How are they going to get the take? How are they going to be enabled? How can you create partnerships, whether it's based on softer things that people want to accomplish or harder evidence-based medicine things that need to be accomplished? How are you going to get the consumer in the stream and in the flow so that they can actually be complementary to the work being done by their clinicians in the sick care system, right? And be in control of those things that they have control of.
So much of what you're saying is, you know, we need to really truly evolve what the expectation has been for what data can do. You know, I think with your perspective, you said you've been in this career or this industry for 30 years.
Yes. Especially
healthcare IT. You know, you referenced that there really hasn't been that much change in health IT, you know, in that time. Do you think that there will be more breakthroughs, you know, in the next 12 to 18 months, 2 to 5 years? You know, what do you think that is on the horizon as far as health IT?
Well, health IT is a very big category, right? We One of the difficult things about this industry is it runs around like herds of antelope. And sometimes antelope run off a cliff,
Okay.
right? And so, you know, we've seen the move towards digitization in the provider world with electronic health records. Now, it's not that electronic health records are a bad thing; they're a very good thing, but they are just really a small part of a technology. Even in a clinical setting, they're a small part, and everyone runs around as if they're the panacea to solving the healthcare solution. So what I think is going to happen over the next 5 years is through events like MediFuture and other thought leadership scenarios, we're starting to cross-pollinate the different perspectives of payers and providers and brokers and retailers and so on and so forth. People got to be disciplined to learn. You know, one of my favorite sayings I actually learned when I played jazz guitar, not in healthcare IT, but it says to be truly innovative, you must first be steeped in tradition. And the cold hard truth is that unless people working on innovation and healthcare IT understand the underlying systems of the existing players in the industry, they're not going to create breakthroughs, okay? In other words, there's never been a garage band that was a breakthrough hit in healthcare IT. It's too difficult in industry. We talk a lot about, disruption, right? It's a big word. Clay Christensen made it very popular, but I think when it comes to healthcare IT, disruption has to be based on respect for the existing methods and methodologies. Has to respect the fact that clinical processes can only move at the speed of culture, right? Has to respect the fact that even though digital technologies can move at the speed of electrons, you can't throw a great technology against a bad business model. Otherwise, you're just paving cow paths. So I'm very hopeful over the next 5 years that we're going to have more collaboration as we move from fee-for-service to volume, that there's going to be more talk among clinicians, among IT professionals, among administrators to understand each other's business models so that we don't just keep building these super silos of healthcare data that leave the consumer stranded on a desert island.
Right. Well, I think that we've heard so much in the last day with our other interviews that collaboration is essential to what they're doing. And I know for Welltok, collaboration is really part of that business model. You have, you select the right vendors that are going to be part of the solution that you're offering. I'm wondering if you want to speak a little bit to how do you vet the different players that are available that you know is going to be a right fit for Welltok?
Right. Well, that's a great question, Kate. So what we do is we kind of break the digital solutions out there into what I would call 6 categories, okay? And of course there's devices. Everyone's talking about these wearable devices people are running around with that give off certain types of data. And then there's apps. And these apps can do anything from, help you count your calories to harass you, if you're not moving around or whatever they want to be. There's condition management programs. Some of us know that we have a chronic condition or are subject to certain healthcare risks, diabetes, asthma, COPD, so on and so forth. And we're getting much better at being able to convey these programs over mobile and other digital channels. Pregnancy, for example, managing a pregnancy would be another great example of that. We look at what people usually call wellness programs. So general fitness and nutrition programs and prevention programs is another category. Content and education. This is a very big category. Consumers don't understand how the healthcare system works. They don't understand their benefits. They don't understand when they should go to the ER versus urgent care. They don't understand what the heck the Affordable Care Act is, right? And so these kind of questions never enter into the old world of clinical sick care, right? But it's first and foremost on the consumer's
Absolutely.
minds, right?
That is the user experience,
right.
Isn't it?
Yeah. And so if you go through these categories, there's one other that's emerged, which is social communities, right? Mm-hmm. And everyone says they're social, and everyone says there's, you know, if you have an app or a device that you've created a social community. I'm not here to argue that point. My point is to say that whether you belong to one or N social communities, mm-hmm. that's got to be brought together for mm-hmm. you too. So the way we vet our partners is we try to, first of all, you know, make sure that our platform is able to handle each of these different types okay. of industry players. We don't know who's going to be the breakthrough on innovation, but what we do know by talking to our customers, we know who they think are going to be the winners. We know who they like. And every once in a while, we find an organization that we just think is truly light years ahead mm-hmm. of others in a particular category. And so what we do is we build a business relationship with these partners, and we integrate them into our platform. So we're reducing two hassle maps. We're reducing the hassle for the healthcare consumer right. in terms of accessing these programs, and we're reducing the hassle for the population health manager, who just think if they have to go find these, negotiate with each one, price one, integrate it into their portals, et cetera, et cetera.
Absolutely.
The Cafe Well platform always puts our customer's brand front and center. It's not about the Cafe Well brand. It's about elevating our customers' relationship with their consumers.
Right. Right. Well, I think on that note, you know, this has been a fascinating conversation, and I know that, you know, from what I've heard, folks going through the Welltok exhibit here have just been blown away by what you're offering. So I really appreciate you sharing all of this experience and your expertise with us here in the GuideWell Insights Lounge. This is Kate Warnock. We'll be back again soon.
Thanks, Kate.
Thank you.